Pelvis and perineum. Development of genitourinary system. Intermediate mesoderm contributes to genitourinary system. Urogenital ridge forms testis, ovary, kidney. Mesonephric duct, Wolffian. Male reproductive tubes. Paramesonephric duct, Mullerian duct. Female reproductive tubes. Epiblast cells, primordial germ cells. By the end of second week or beginning of third week, migrates to endoderm wall of yolk sac. Through dorsal mesentery of hindgut goes to urogenital ridge by fifth week and converts into oocytes or spermatocytes. If baby is male, in short arm of Y chromosome SRY gene codes for TDF, testis determining factor. Testis is formed. Testosterone, Leydig cells, Mullerian inhibiting factor. Sertoli cells inhibits Mullerian duct and male characteristic features are developed. No SRY gene. Ovary and female reproductive system. Week 5, genital ridge appear. Week 6, indifferent gonad. Testis starts developing at 7th week. Ovary starts developing at 8th to 10th week. Sex determination not possible till week 6. Indeterminate embryo. External genitalia well differentiated. Week 11 to week 14. Ultrasonography sex differentiation can be done this time. Development of renal system. Intermediate mesoderm forms pronephros, mesonephros, metanephros. Kidney developed from metanephros. Pronephros degenerated. Mesonephros leaves behind mesonephric duct and degenerated. Mesonephric duct gives ureteric bud. Ureteric bud stimulated metanephros to form metanephric blastema, forms kidney. Ureter comes from ureteric bud or mesonephric duct. Endoderm of urogenital sinus form urinary bladder, urethra or lower two-thirds of vagina. Kidney has two portions. Excretory system comes from metanephros, collecting system comes from ureteric bud derivatives. Tip of mesonephric duct is absorbed into posterior wall of urogenital sinus, forms trigone of urinary bladder, so mesodermal in origin. Ureteric bud derivatives. Embryo, adult derivatives. Embryo. Metanephric mesoderm, metanephric vesicles, S-shaped renal tubules. Ureteric bud. In adult derivatives, connecting tubule, distal convoluted tubule, loop of Henle, proximal convoluted tubule, renal, Bowman's capsule, renal, glomerulus. Ureter, renal pelvis, major calyx, minor calyx, collecting duct. 5th to 6th week. Sexually indifferent stage. Gonadal ridge in each side become testis or ovary. Mesonephric duct on each side. Paramesonephric duct, Mullerian duct on each side fuse in midline, and there is midline opening in dorsal wall of urogenital sinus. Also there is mesonephric duct opening on each side of Mullerian duct. So there are three openings in urogenital sinus. Gonadal ridge, mesonephric duct, paramesonephric duct forms intermediate mesoderm. 7th to 8th week, male. Gonads change into testis and give sperms. Collecting system to collect sperms forms from mesonephric duct, also known as Wolffian duct. Mesonephric duct gives epididymis, ductus deferens, seminal vesicle, common ejaculatory duct. Storage of semen, motility and maturity of sperm. Epididymis also in ductus deferens. Paramesonephric duct gives some vestigial remnants like appendix, testis in cranial end and prostatic utricle opening into dorsal wall of urogenital sinus. Three openings are seen in adult male as seminal colliculus or verumontanum on posterior wall of prostatic urethra. 8th to 9th week, female. Gonads become ovaries. Ovulation happens. Secondary oocyte is taken by fallopian tube. Fallopian tube, uterus, upper one-third of vagina from Mullerian duct. Mullerian duct has three derivatives. Fused part, uterus, upper one-third vagina. Unfused part, fallopian tube. Lower two-third vagina develops from endoderm of urogenital sinus. Mesonephric duct remnants, eubuphron, parophron, Gartner's duct in anterolateral wall of vagina, also seen in broad ligament.